So the first thing I'm going to go ahead and do is start by washing my hands, and then I'm going to verify the healthcare provider's order. So the patient is complaining of pain in their left knee, and the order is to give them Demerol in their right vastus lateralis. The order is for 70 milligrams. So the first thing I'm going to start by doing is verifying my materials and making sure that they're safe to use. So I have unused gloves, unused alcohol wipes, a bottle of Demerol that is 50 milligrams per milliliter that expires 12/31/2020, so that's safe to use. I have a 3 milliliter syringe that expires February 29th, 2024. It's unopened, so it is safe to use. And I have a 22 gauge needle that expires November 30th, 2023, and it's unopened, so it's safe to use. So now I'm gonna go ahead and start by doing my med math. So the healthcare provider ordered 70 milligrams, and the concentration in the bottle is 50 milligrams per milliliter. Get 1.4 milliliters. So I'm going to double check that. So 70 milligrams was ordered for one dose, and the vial concentration is 50 milligrams per milliliter. Get 1.4 milliliters again. So I've done both of my med math checks, and they came out the same. So now I'm going to start my first MAR check. So the patient's name is Jamie Hernandez. The ID is 6/10/51/3498. The date of birth is January 1st of 66. The patient's allergic to penicillin, aspirin, and sulfa. Those do not interfere with the drug Demerol, which is being given injection IM in the right vastus lateralis. The ordered dose is 70 milligrams, and we found that to be 1.4 milliliters. This medication is given PRN for pain every 4 hours. It has not been given yet, so the first injection will be at 8 o'clock. So now I'm going to start my second MAR check. So the patient's name is Jamie Hernandez. Their ID is 6/10/51/3498. Date of birth is January 1st of 66. Their allergies are penicillin, aspirin, and sulfa. This does not interfere with the drug Demerol, which is being given injection IM in the right vastus lateralis. It's ordered 70 milligrams, and we found that that was 1.4 milliliters. This medication is being given PRN for pain every 4 hours, and it hasn't been given yet, so the first dose will be at 8 o'clock. And the vial of Demerol comes in 50 milligrams per milliliter and doesn't expire till 12/31/2020, so it is safe to use. So now I'm going to go ahead and I'm going to start with preparing my injection. So the first thing I'm going to do is I'm going to clean the top of the Demerol vial, leave the alcohol pad on. I'm going to open my syringe. I'm going to open my needle. I'm going to twist on, make sure that it's on there tightly so that it doesn't come off while giving the injection to the patient. I'm going to remove the needle cap. I'm going to draw up 1.4 milliliters of air. I'm going to remove the alcohol swab from the top of the vial. Inject the air into the vial. I'm then going to turn it over and draw up more than 1.4 milliliters. I'm then going to make sure there are no bubbles in the vial. There are none. So I'm going to push back to 1.4 milliliters. do a one-handed recap. .4 milliliters. So now I'm going to go ahead and prepare my label for my syringe. The patient's name is Jamie Hernandez. We're giving the drug Demerol, which comes in a concentration of 50 milligrams per milliliter. It's ordered 70 milligrams, which we found to be 1.4 milliliters. We're giving this injection on 12/11/20 at 8 o'clock, and my initials. Going to put the label on the syringe. I'm going to gather my supplies. I'm going to enter the patient's room. Hi, Mr. Hernandez. My name is Emily. I'm going to be your student nurse today. So today we're just going to be giving you an injection for your knee pain, and I would provide for privacy. I'm just going to ask you a few questions here. So I'm going to have him verify his name and date of birth. So Mr. Hernandez, what is your name and date of birth? And he'll say his name is Jamie Hernandez and his date of birth is January 1st, 66, which matches my MAR and the ID bracelet. Then I'm going to check the ID bracelet against the MAR. I have Jamie Hernandez, 6/10/51/34/98. The patient ID numbers match, and the birthday 01/01/66 also matches. So I'm going to ask Mr. Hernandez if he has any allergies. He says that he's allergic to penicillin, aspirin, and sulfa, which matches my MAR. And I'm going to ask him, I've already asked him his name, so now to assess his level of consciousness, I'm going to ask him who the president is and what day it is. He says the president is Donald Trump, and that the day is Tuesday, so he is alert and oriented ×3. So I'm going to do my final MAR check against my syringe before I administer the medication. So the syringe is labeled Jamie Hernandez, which matches my MAR. The patient ID number is 6/10/51/34/98, and the date of birth is January 1st, 66. The drug on the label is Demerol, and that's what we have ordered, which is being given injection IM in the right vastus lateralis. This is being given, the Demerol comes in a 50 milligram per milliliter vial, and the ordered amount is 70 milligrams, which we found to be 1.4 milliliters, which also matches the MAR. This medication is being given PRN for pain every 4 hours. It has not been given yet, so we'll be administering at 8 o'clock. And the date, 2/11/20, also matches the MAR. So now we're going to go ahead and get prepared to administer the medication. Put on my gloves. And I would raise the bed rails, or I would lower the bed rails and raise the bed. So next what I'm going to do, turn the patient over, look for their greater trochanter, which is right here, and their lateral femoral condyle, which would be right here. Turn my hands inward to find my position. I'm going to assess that spot for any bruising, redness, tenderness, masses, edema, and I'm going to grab my alcohol wipe, open it. I'm going to clean in a 2-inch diameter around the area and leave it there to mark my position. I'm going to remove the cap off my needle. Remove the alcohol wipe, pull the skin taut, and enter at a 90-degree angle. Then going to stabilize the injection and slowly and steadily inject the medication. I'm going to remove the needle, engage the safety, hold gentle pressure on the wound to ensure that there's no bleeding or anything. I'm going to turn the patient over, dispose of the needle in the sharps container. I would then ask the patient if they needed anything, if they were feeling any pain, or if anything was wrong, and then I would raise the side rails, lower the bed, and I'm going to go ahead and gather my materials and dispose of them. Remove my gloves. And then I would I would wash my hands. And I would start my documentation. So I'll start by signing my initials on the top so that everybody knows that my initials belong to me. Then the medication was given at 8 o'clock in the right vastus lateralis by me, and I would initial it. And then I would let the patient know that I'll be back soon, and if they need anything to hit their call light, I would wash my hands. When I was finished washing my hands, I would exit the room.